when I was 16, I started on puberty blockers, and I was on that for a year, and I continued with it for an extra year along with cross-sex hormones. I felt angry that, no one was there to really say any different, and I was allowed to run with this idea that I had.
I had top surgery when I was, it was a month before I turned 17. I honestly don't think I was at an age where I was able to fully, truly understand. I obviously realized at a surface level, yeah, there's a chance I could regret this. There's a chance that anybody could regret something down the line. But I was just so sure that that wasn't the case.
When I was 16, I decided that I was trans, but I took testosterone for a few years, and I had 2 botched surgeries on my chest, and immediately after the second one, the denial that I had been in for the last few years just fell apart, and I was faced with the fact that I was living a lie and that I just couldn't do it anymore.
There's no other medical condition that leads to a massive surgery and medical intervention where the diagnostician is a pre-adolescent child and the doctor has no way of proving or disproving it. How do you give consent to something like that?
It is incredibly unethical to expect that a teenager or younger has the cognitive ability to consent to drugs and procedures that could wipe out their fertility and put them at risk for deadly diseases in the long term.
Despite adolescents' known tendency to engage in risky behaviors, poor impulse control, and failure to see or appreciate long-term consequences of their choices, the immediate desires of gender dysphoric youth are deemed sufficient for them to consent to potentially irreversible medical interventions.
Mastectomies of perfectly healthy breasts are happening to girls as young as age 13 and 14 in the United States. How can these girls provide informed consent as they are not fully mature adults?
I don't envy these parents. I mean, I think they're making decisions in a very difficult environment. I mean, I know that we do informed consent, but really, I mean, how realistic is it to believe that a 14 or 15-year-old or a 16-year-old has really the capacity to make that kind of decision for him or herself?
How do you consent a 14-year-old to lifelong infertility? How do you consent a stressed 17-year-old to permanent voice changes, increased risk of heart disease, and all the other physical changes?
How can a little child consent to this? How can they possibly understand the harms? How is this permissible legally or ethically?
I'm on the verge of cross hormones right now. I'm excited just to become a woman, to have breasts, to have a beautiful figure, to just be a woman.
We signed the legal papers on Friday, so it's all set with the cross hormones, and I'm really excited.
The guidelines have always said that cross hormones should start when an adolescent is 16 years old, and that's something that we've been working on with our therapist. He really feels that Ariel is ready.
My excitement to start the cross hormones completely overrules my despair to just not have a child of my own.
I already feel like I've gone so far and I'm only 13.
What are the ethics of permanently medicalizing a condition in a child that overwhelmingly desists, overwhelmingly goes away by adulthood, and doing it on the basis of a self-diagnosis?
How can an 11-year-old give consent to taking medication which is going to have long-term, unknown, as you say, consequences? What is really striking is the lack of the usual appropriate medical caution.
The High Court ruled that children under 16 are unlikely to be able to give informed consent to undergo treatment with puberty-blocking drugs. The case was brought by Kira Bell, who'd been prescribed the drugs aged 16. In effect, the court said no. It said it was doubtful informed consent was possible for under 16s, and even for those who were 16 or 17.
I'm delighted at the judgment of the court today. It was a judgment that will protect vulnerable people. I wish it had been made for me before I embarked on the devastating experiment of puberty blockers.
children can't make a choice like that. They don't actually have the ability to make informed consent. The ramifications of it are so serious because it involves people being sterilized, and that's just so horrible.
I really don't think at that age that you can know absolutely everything about yourself. But I regret having made the decision when I did. I made that decision and I did that at such an early point in my life. And I wish I could go back and have a redo button